Hello again, it's Dr. Jarrod Bagley with falling apart syndrome is what we've been talking about. And we've been talking about symptoms associated with the upper extremity. We started at the shoulder, we went to the elbow. Today, the last video that we're going to focus on is going to be the wrist injuries, wrist problems. By far the most common complaint that we get around wrist issues, wrist problems, symptoms around the wrist is carpal tunnel. Carpal tunnel is defined as the specific nature of what's going on, and the carpal tunnel is actually a retinaculum, a tendinous circular sheath that houses all the tendons and ligaments that come into your hand, but also the median nerve that innervates the thumb as well as a portion of the finger and the palm. Now, the median nerve actually comes out of the lower neck. The nerves coming out of C5, C6, and C7, the lower three vertebrae of your cervical spine or your neck, are the nerve roots for the median nerve that feed into this brachial plexus of neurovascular supply to the upper extremity. So whenever you have carpal tunnel, there's several things that need to be checked. For one is nerve compression at the neck. And so that can be based on a vertebrae that's jarred out of place, creating subluxation that causes soft tissue damage and inflammation around the joint that presses on these nerves, that sends those incorrect signals into that area to cause symptomology or weakness or delayed healing response into the wrist and the carpal tunnel if we do have definite inflammation in that tunnel. The reason it's referred to as carpal tunnel, because in many cases it's the mechanism of injury that aggravates and inflames that tunnel. So in addition to removing the nerve stress, whether it be at the neck or impingement at the shoulder or the elbow that's creating these symptoms that are associated with carpal tunnel, which is pain in the wrist and the hands, the thumb, the thenar, this nerve impingement definitely could be the cause of it and prolonging the situation and delaying the healing capabilities. But the other things that we have to do are to rest, change the lifestyle habits that are creating this. You've probably seen people that are at a desk. So most commonly this affects people that with their hands in this position. So ultimately what that does is it flattens out that tunnel that these nerves and these tendons roll through, and when it flattens out and you get constant stress in that position, it causes inflammation in the tunnel as well. So this could be specifically at the tunnel. So at that point we need to improve the habits. So the ergonomics in most cases are creating this irritation in the wrist that is irritating the median nerve and causing this carpal tunnel syndrome. So the other thing is to ice, decrease that inflammation. So utilizing ice, and then also bracing. You can use tape, or there's all kinds of videos on YouTube that will instruct you on how to use KT tape or kinesio tape or elastic type taping to support the carpal tunnel. For more information, please just reach out to us, send us an email. Just wanted to provide you this information to let you know that it's more in many cases than just the tunnel itself that needs to be addressed or bracing. You need to incorporate it's cumulative. In other words, you need to incorporate a whole series of things and changes in order to resolve this issue long term. Hope this message finds you all doing well. Remember, I love you. I'm Dr. Bagley, and thank you again for helping me be the doctor that makes people stronger.